I think we'll get started. We are really excited to have this day finally here, and I thank you all so much for making time in your very busy schedules. We know that you're grading, doing the papers, you're polishing things off, you're getting student calls in line for graduation, so thank you so much for being here. I want to acknowledge that the University of Minnesota is built within the traditional lands of the Dakota people. Minnesota, the word itself, comes from the Dakota name for this region, which is the land of waters that reflect the skies. And we certainly see that today in just about every corner and turn that we make. Currently, Minnesota is home to people that originated from all over the globe. And our clean air and our clean water and our locally grown foods help support our lives and our health. But the health of humans is inseparable from the health of the planet. The entire system is one ecosystem. And nurses are system thinkers, and the health of the system is failing. It's time for nurses and those who work with us to care for the health of the planet. And Dean Delaney's vision is that the School of Nursing will become a national nursing leader center on planetary health education, research, and service. And to that end, we welcome Dr. Sam Myers to the School of Nursing. So I'm going to read you briefly from his bio, but there's much more than what I'm going to tell you. Dr. Sam Myers is director of the Planetary Health Alliance. He works at the intersection of human health and global environmental change. He received his BA from Harvard College, his MD from Yale Medical School, and then he performed his residency in internal medicine at the University of California, San Francisco. He received his MPH from Harvard School of Public Health. For 2 years, Dr. Sam Myers was the founding field manager of the Integrated Conservation and Human Health Project in a nature preserve in Tibet. He then worked in the Global Health Bureau of the U.S. AID, and he designed a new mechanism for administering and studying projects that integrate human health, population growth, and environmental change in developing countries. He's currently the principal investigator on 4 transdisciplinary research projects. In addition, he is co-leading new research efforts focused on quantifying the nutritional importance of access to fisheries at both local and global levels. He does research in Madagascar. Dr. Myers is a commissioner on the Rockefeller Foundation Lancet Commission on Planetary Health, and he's the recipient of the Prince Albert of Monaco Institute of Pasteur Institute Award in 2015, which is awarded to people for outstanding contributions in the field of global environmental and climatic changes and their impacts on human health. Please welcome Dr. Sam Myers.
All right, well, thank you so much, Teddy, and thank you all for being here. I'm amazed that anybody's in the room, given the timing of all of this, so thank you for coming and for your attention. I'm not sure there's much left to say after what Teddy was describing so eloquently, but I guess the idea is to try to give you just a little bit of a primer on planetary health for those of you who are not totally familiar with it. I think some of you are probably more steeped in the kind of One Health ideas, and this is sort of a cousin of that. And so what I want to do is give you a little bit of a sense of sort of what is this moment that we're in and what's happening to our natural system that Teddy was talking about, and then why do we think that has real implications for human health by describing a little bit of my own research in that space, but then broadening to talk about how environmental change really is affecting nearly every dimension of health, and then start to explore, what are some of the overarching principles in planetary health, and then what does that imply about how we move forward and what we do. And it's a small group, so if things are unclear while I'm speaking and anybody wants to raise a hand for clarification, that's totally great. So 50 years ago or so, on Christmas Eve in 1968, Bill Anders looked out the window of the first manned spacecraft ever to orbit the moon and took this photograph of Earth rising up above the moon's horizon. So it was the first time that a human being had been far enough away from our planet to see it as really a separate entity, whole and distinct. And it was breathtaking. Anders would write letter, we came all this way to explore the moon, and the most important thing is that we discovered the Earth. The photograph that he took and others from subsequent Apollo missions really became these iconic images for the environmental movement, the first Earth Day in 1970, and they sort of came to symbolize Earth's beauty, isolation, fragility, and apparently unique capacity to support life. But the same really sort of awesome technological mastery that brought Anders and others out into space and around the moon was also fueling just this really massive expansion of humanity's ecological footprint. The sum total of sort of all of our activities and the impacts of our activities on our planet's natural systems. About the same time that Anders and the Apollo astronauts were bringing home these iconic images of Earth from space, we were entering a new geological epoch, the Anthropocene, in which human activities had really become the dominant force shaping our planet's biophysical conditions. And since that time, we've been living in this period that Stefan and his colleagues have called the Great Acceleration. So let me show you what that looks like. If you look at these graphs of human consumption patterns over time, what's really striking is whether you're looking at appropriation of fresh water or proliferation of motor vehicles or production and use of synthetic fertilizers, paper, plastic production, or primary energy use, you see a very, very similar pattern where what our consumption looked like pre-1950 is essentially unrecognizable from post-1950, and we're in this sort of period of really exponential increase in what global human consumption patterns look like. And not surprisingly, if you look at our impacts on our planet's natural systems, you see very similarly shaped curves, whether you're looking at global biodiversity loss, exploitation of fisheries, addition of carbon dioxide to the atmosphere, ocean acidification, or loss of tropical or indeed temperate forests. You see this sort of accelerating, nearly exponential kind of impact really across all of our planet's natural systems. And so, maybe not surprisingly, this great acceleration has led to what Gus Speth has called the great collision between humanity and our planet's natural systems. Really, as a result of this very, very steep rise in human population over a short period and an even steeper rise in our per capita consumption patterns, we've just seen this kind of astronomical ballooning of the total impact of human activity across our natural systems. So every year, in order to feed ourselves, we have appropriated about 40% of Earth's land surface for croplands and pasture. We're using about half the accessible fresh water on the planet, mostly to irrigate our crops, and we're exploiting 90% of monitored fisheries at or well beyond their maximum sustainable yields. In the process, we've cut down between 7 and 11 million square kilometers of the world's tropical and temperate forests. We've dammed over 60% of the world's rivers, and we're now seeing this sort of growing global problem of air, water, and soil pollution as our production of wastes really outstrips our planet's capacity to absorb those wastes. In the process, we're crowding out life on the planet. So species extinction rates are about 1,000 times the baseline rates. The population sizes, meaning the numbers of individuals within a species, the population sizes of mammals, birds, reptiles, amphibians, and fishes has dropped by over 50% since 1970. Many of you will have seen the report that came out earlier this month from the Intergovernmental Panel on Biodiversity and Ecosystem Services, suggesting that about 1 million species now face extinction, many within decades. So all of this is happening at the very same time that we're seeing these really exciting improvements in global health, right? So life expectancy in the last 50 or 60 years has been, going up and up and up globally, from about 47 years to about 69 over the last 60 years, and child mortality has dropped by a factor of 4. So we're seeing these really wonderful improvements in human health around the globe at the same time that we're seeing these patterns of environmental change that are deeply concerning. So in 2015, the commission that Teddy mentioned, the Rockefeller Lancet Commission on Planetary Health, produced a sort of first big report for planetary health, which was kind of the beginning of the emergence of this new field. So it's a very young field. And we addressed this apparent sort of ecological paradox really head on, saying that as a commission, we're deeply concerned that the explanation for this ecological paradox is straightforward and sobering. That we've been mortgaging the health of future generations to realize economic and development gains in the present. By unsustainably exploiting nature's resources, human civilization has flourished, but now risks substantial health effects from the degradation of nature's life support systems in the future. So essentially we're flagging this gigantic issue of intergenerational equity, right? That we are gaining the benefits of unsustainable resource use while deferring the costs to future generations. Just as we sort of know that, or sort of come to understand over the last few decades, that human health is nested in a set of cultural and political and social determinants, we're now coming to understand that health is also nested in a set of ecological determinants, that indeed human health, or most dimensions of health that you can see here, are impacted in a whole series of really complex ways by changing environmental conditions. So this is sort of a schematic for planetary health. It's a little foreshortened here, but and really the core premise of planetary health is that the scale of the human enterprise, that it really outstrips now our planet's capacity to absorb our wastes or produce the natural resources that we're demanding sustainably. And as a result, our activities are really degrading, disrupting, transforming just about all the major natural systems on the planet. So this conversation is not restricted to climate change. Climate change is one system that we're disrupting, but we're also polluting air, water, and soil at a global scale. We just talked about global biodiversity loss. We're altering nitrogen, carbon, phosphorus cycles significantly. Changes in land use and land cover with deforestation, dams, irrigation, loss of coastal land cover, and big issues around water scarcity and arable land scarcity. And so all of these sort of large-scale, global, anthropogenic, human-caused environmental changes that interact with each other in really complex ways that we're only just beginning to understand, to ultimately affect these kind of proximal conditions for human well-being and the well-being of all other life on the planet. So the quality of air that we can breathe, the quality and quantity of food that we can produce, our exposure to infectious diseases, access to fresh water, exposure to natural hazards, and ultimately impact every single dimension of human health. So I thought I'd start by talking just a little bit about my own work in this one dimension of nutrition, and then kind of expand out just to give you a sense of what this work looks like. So I'm going to share as quickly as I can 3 case studies of research that I've been involved in the last 10 years to give you a sense of what does it look like to do planetary health research. And so I'm going to talk about the impact of rising CO2 on crop nutrients, the impact of pollinator declines on human health, and the impact of changes in fisheries very briefly. So the first story is about rising CO2, and this research was really prompted by a handful of studies that were in fairly esoteric journals of kind of crop science that suggested that if you grow crops at higher concentrations of CO2, they lose a lot of their nutrients. And it was a really contested literature for a couple of reasons. One was that most of these studies were being done in chambers and greenhouses, so in artificial growing conditions, often in pots. And the plant physiologists were disputing whether we were just seeing what they called sort of root effects or pot effects, and whether this was just an artifact of these artificial growing conditions. The second problem was one of sample size. It's really hard, as probably some of you know, to get a large sample size when you're doing these agronomic experiments, because you can grow an entire crop in a field and compare it to an entire, different crop or grown under different conditions, and you end up with an N of 1. And so to get the statistical power to show statistical significance can be very challenging. And so none of these studies really had statistical power. And so we set about to address both of those problems about 10 years ago by building a sort of coalition of agronomists from around the world who were using this sort of gold standard technique of FACE methodology, which stands for free air carbon dioxide enrichment. And so using these methods, you are growing crops in open field conditions, and a cultivar inside this ring of carbon dioxide emitting jets, right? So these are CO2 emitting jets. And then in the middle of the ring, there'll be a little CO2 sensor and a wind direction sensor. And so in that fashion, every time the CO2 falls below some prescribed level inside the ring, the upwind CO2 jets blow out a little bit more, and they can maintain the CO2 at a prescribed level, which in this case was 550 parts per million, which is where, unfortunately, we are almost certain the world will be sometime in the middle of this century. So in this way, the crops inside this ring are identical to the crops outside it. Same cultivars, same growing conditions, same weather, same pests, same pathogens, et cetera, et cetera. The only difference being the CO2 at which they're grown. And so we brought together people that were using these methods for other reasons around the world, and ultimately collected these 6 staple food crops that were grown on 7 locations in 3 continents over 10 years with 41 different cultivars. And that gave us a large enough sample size to actually show that indeed rising CO2 was threatening human nutrition, that we saw really significant reductions in iron and zinc in all the C3 crops, and in protein in the grains like wheat and rice, and less effect in C4 crops, which we can talk about later if you're interested. It's sort of esoteric, but there are a handful of crops like corn and sorghum and some of the millets that are C4, which are less affected. So why did this matter? Well, so we showed these significant reductions. The reasons it really matters are that about 2.75 billion people are getting 70% of their dietary zinc and or iron from the kinds of crops that were losing those nutrients. And we have a baseline right now today of nearly 2 billion people in the world who are suffering from deficiencies of those nutrients at a really, really large global burden of disease, around 60 million life years lost annually. So we've got a big, huge public health problem right now from people not getting enough of these nutrients. Where people get those nutrients from is these kinds of C3 crops, and those kinds of C3 crops are losing them. So the question that we really wanted to answer from this work was, okay, that sounds scary, but how many people are really going to be put at risk? So this is about what's happening to plants, but what's going to happen to the people? And it turns out that that's a hard question to answer. And to answer it requires modeling what people around the world are actually eating. And that data didn't really exist, so we sort of paused a little bit and spent quite a while building what's called the Global Expanded Nutrient Supply Database, the GENUS database, which now estimates the per capita intake of 225 different foods for the populations of 152 countries, with the nutrient densities of every one of those foods for 23 nutrients, by age and sex across 26 different age-sex categories. So we did that in a variety of different ways. We built that data set, and then we used the data set to say, okay, well, if that's what the world's eating, if we assume that people continue with their existing diets, which is obviously incorrect, but it's really hard to know exactly which way they're going to be changing over the next several years, so we'll just hold that constant and ask specifically, what is the effect of only CO2 on people's nutrient sufficiency, on the amount of iron, zinc, protein that they're getting from their diets if we project out to around 550 parts per million by the middle of the century. And so we did that kind of modeling study, and the first paper we wrote was about zinc, and we showed that the effect of rising CO2 alone would push somewhere between 150 and 200 million people into new onset zinc deficiency, in addition to exacerbating the existing deficiency in around 1 billion people. This past fall, we published a sort of synthesis paper of all of our work, which included zinc and also iron and protein, and we found sort of similar effects between zinc and protein, 150 million or so people pushed into protein deficiency. And for iron, the story is more complicated because estimating deficiency from the diet is a much more complicated proposition for a variety of reasons. And so rather than trying to do that, we just asked, who's our vulnerable population? And our vulnerable population for iron deficiency are women in their childbearing years and kids under 5. So we asked how many of those women and kids are living in countries with high rates of anemia right now today, like over 20% rates of anemia, and who would lose more than 4% of their dietary iron as a result of this CO2 effect. And the answer really surprised us. It was almost 60% of the women and children in the world, or 1.4 billion women and children, fell into that category. So the point here is that rising CO2 in ways that we didn't anticipate is actually putting a whole lot of people around the world at risk. Another important point is that this isn't a homogeneous distribution of risk, right? This is, really congregated around, in North Africa for protein, if we looked at zinc, back up, it looks a little different where you get most of sub-Saharan Africa, South Asia, but the people that are vulnerable are primarily in all over Africa and South Asia. Okay, so that was the CO2 story. The second story is about pollinators, and I'm just going to catch up because I'm not really using my notes here. Pollinators. So what we know about pollinators is that before we did any work, there are a few great papers showing that pollinator-dependent crops provide a whole lot of the calories in the global human diet, and another study showing that they provide a whole lot of the micronutrients in the human diet. And there was speculation that declines in pollinators would be problematic for those reasons. But again, it's hard to know if that's true because it really depends on what people are eating again. If you're getting tons of vitamin A in your diet and you lose vitamin A, well, that doesn't really matter very much because you've got plenty. If you've got access to tons of calories in your diet and there are fewer calories, well, that doesn't really affect you too much. So the question is, who is living relatively near a threshold of nutrient sufficiency and is depending on pollinator-dependent crops for a large share of those nutrients? Those are your vulnerable people. And so we set about to look at that. And I guess there was one other wrinkle. So by and large, most of the previous work had been done looking at things like vitamin A and folate deficiency. And we'd become really interested in this last global burden of disease analysis that had come out in 2012, which described these low intakes of whole food groups, fruits, nuts and seeds, and vegetables, as really important in driving global disability and death as a result of the sort of the loss of the prophylactic effect of consuming these foods and their impacts on the non-communicable diseases like heart disease, stroke, some cancers, and diabetes. So we took the same genus database I told you about, which tells us what people are eating and what's in it, and we combined it with this global database of the pollinator dependence of all food crops in the world that the ecologists have been building. And then we did some scenario analyses where we looked at different levels of pollinator declines globally, and we asked how those declines would affect yields and ultimately intake of the different foods, and how that would affect 5 health outcomes. So the 5 health outcomes were people falling below the estimated average requirement for vitamin A and folate, so we could quantify those, and then also reduced intake of those 3 food groups: fruits, nuts and seeds, and vegetables. And then we took those 5 health outcomes and we added them together to essentially get what's the total burden of disease from these pollinator declines. And one of the things that was really interesting to me anyway was that usually the story we hear, whether we're talking about climate and health or planetary health, is that it really stinks to be poor. And you see these graphs like the ones I showed you before, where most of the vulnerability sits in sub-Saharan Africa, South Asia, the poorest regions of the world. And when you look at vitamin A and folate deficiency, there you see it again. But when you look at actually the bigger burden of disease from pollinator declines, it's actually from this increased risk of these non-communicable diseases, cardiovascular disease, stroke, certain cancers, diabetes. And the big risks there are sort of former USSR, Eastern Europe, but also, really around the developed world. And the reason for that is that the underlying risk of those non-communicable diseases is much higher in the somewhat wealthier countries that have already transitioned and are dealing with obesity and sedentary lifestyles and Western-style diets, et cetera, et cetera. And so they have higher risks of those diseases, so they're depending more on these pollinator-dependent crops to protect them from them. And so that was sort of interesting. Overall, we found somewhere around 100 million people being pushed into vitamin A and folate deficiencies, and this relatively large risk associated with total pollinator declines. Now, hopefully we're not going to have total pollinator declines.
Do you know if you held trade constant?
Yeah, we held everything else constant in this scenario.
Because I'm wondering if the developed world would basically do what it's done, protein intake more these vegetables.
Yeah, so that's a great point, and we described that in our paper. We said that in a lot of ways we think that, especially when you're talking about something like nuts and seeds, which are relatively expensive and also transportable, that our estimates are probably conservative because they imply that everything is sort of evenly distributed around the world, and in fact what's going to happen is that markets are going to allow the wealthy parts of the world to protect themselves and push the vulnerability more towards the poor. We didn't know how to actually model that directly. In fact, we're right now starting a whole new research project that's really getting into trade and trade shocks, but we did not do that for this. So you're right. In some ways, this is probably conservative. Yeah.
Did you put a variable in there as far as for nuts and seeds sensitivity at all?
Sensitivity.
So, like, if you're allergic to nuts and seeds, I mean, did you kind of quantify that too, or you did?
We did not. We did not look at allergic disease or look at sort of population prevalences of allergies, because the actual global burden of disease calculations that are done by IHME in Seattle don't use that. So we essentially worked directly with them. They put out the burden of disease. We asked them to recalculate their burden of disease with new distributions of foods that came from our pollinator modeling, and that didn't include any kind of nut sensitivities. Yeah. The point here is not to say that 1.4 million people are going to die every year from pollinator declines tomorrow, because we are not going to experience complete pollinator collapse tomorrow. It's to say that the ultimate health value of robust pollinator populations is very high, and it also is essentially linear. So a 50% reduction in pollination services would lead to about 700,000 excess deaths annually. Okay, I'm not going to go into any more of those details. The last project is still less complete, and it's looking at how primarily ocean warming, but also overfishing, acidification, these big drivers that are changing the distribution of fisheries and also the size of fisheries around the world might impact human nutrition. And again, the first real question is, how do we define vulnerability? Who do we think would be at risk from loss of access to wild harvested fish? And so we ask that question the same way by saying, well, so how many people around the world are living near a threshold of sufficient intake of a variety of nutrients, of iron, zinc, omega-3 fatty acids, which are super important from fish, B12, and then how many of those people are near a threshold and are depending on wild harvested fish for at least 10, I think it was even 20% of their total intake of that nutrient? And the answer was 1 billion people. It was 800 million for one and 1.4 billion for a couple of other nutrients. So lots of people in the world are vulnerable. And now what we're doing is actually a more complicated sort of bioeconometric model where we're looking at fish trade, working with the Sea Around Us project in British Columbia. But again, just trying to tease out how our disruption of these wild populations of fish ultimately is going to percolate down through trade and markets and affect human health outcomes. I'm really using my notes. Where am I? Okay. So these are just a few little snapshots, right? If we think about malnutrition and environmental change, this is a little smattering of climate change. I'm just talking about how CO2 affects plants directly. I haven't talked about how climate change is going to affect crops. The pollinator declines, fisheries collapse. We're also working, as Teddy said, in Madagascar, looking at bushmeat consumption and how losing access to bushmeat would affect health outcomes in populations. And then there are a ton of other things: water scarcity, land degradation, population displacement, soil and air pollution that affect food production, and inevitably more surprises, all of which create a super complex picture of how just transforming all the biophysical conditions that underpin our entire food production system are going to affect the quality and quantity of food that we can produce. And the point is that we could make a very similar kind of picture for just about every other dimension of health. And so I thought I would just much more quickly run through some of those other dimensions just to give you a little bit of a feel for what that work looks like. So these guys are in upland Belize, growing their crops, minding their own business, trying to increase their yields, and putting fertilizer on their fields. What they don't know is that the potassium, nitrogen, phosphate that they're putting on their fields is trickling into waterways, coming together in streams, flowing down in rivers to lowland Belize, where the extra nitrogen in particular is triggering a whole ecological transformation of one type of reedy vegetation called these typhal mats, of one type of typhal mat to another type of typhal mat, because there's more nitrogen in it actually leads to an advantage for the other type of vegetation. Turns out that other type of vegetation is better for a different species of Anopheles mosquito. And so you're getting a transition from Anopheles albuminus to Anopheles vestipanus. Well, it turns out that Anopheles vestipanus is a much more effective malaria vector than albuminus. And so, unwittingly, these guys putting fertilizer on their fields is putting their sort of lowland compatriots at higher risk of malaria. And in fact, in ways that are sort of counterintuitive, at least to me, in a meta-analysis of 41 different pathogens on 6 continents, this sort of nutrient enrichment seems by and large to increase infectious disease exposure most of the time. I'm not sure why that would be, but it does seem to be the case. But the point is that you get these sort of complex changes, and we see this all the time. So again, we said that health is nested in environmental conditions. In this case, infectious disease exposure is affected by a whole host of changes in temperature, precipitation, and water and humidity that affects vector-borne diseases. These nutrient flows that I just talked about, the species composition of certain communities, and this idea of the dilution effect, all of which affect the composition of species and ultimately the types of vectors and their life cycles, and therefore our exposure to infectious diseases. Population displacement is another real big concern in planetary health. Last year, the UNHCR, the United Nations High Commission on Refugees, documented the largest number of displaced people in the history of its record keeping, with 65.6 million displaced people, half of them children who were forced to leave their homes. The role that's played by accelerating sort of environmental change in driving displacement is complex. Most people sort of think of it as a threat magnifier. It's clearly multifactorial. You see, combinations of poor governance, crop failures, poor land management, but clearly environmental change is one really important factor that's driving more and more population displacement around the world. The recent civil war in Syria that has displaced millions of people was clearly, again, multifactorial product of all of those factors I just said: population growth, poor governance, really bad agricultural policies. But it was also preceded by the worst drought in the instrumental record, the 3-year drought. That was clearly made more likely in the context of climate change. And so that's sort of an additional threat magnifier. And we know that the human health impacts of forced displacement are huge. The populations that are forced to move have much higher rates of malnutrition, of infectious diseases, particularly epidemic diseases like measles, cholera, and a lot of physical and sexual and psychological trauma associated with displaced populations. It may be a little bit less intuitive that environmental change is affecting the non-communicable diseases as much as it is. A couple of years ago, another commission, the Lancet Commission on Global Pollution and Health, came out and really put this issue on the map, showing through a sort of a whole variety of new analytic approaches and new data that they estimated that there are now 9 million excess deaths each year from pollution of air, water, and soil alone, and that about 70% of those excess deaths are in this non-communicable disease realm. I just mentioned how loss of pollinators affects the non-communicable diseases. One of the sort of quirks of our carbon dioxide nutrition work that I haven't talked about is that essentially you're doing this huge dietary substitution. You're removing protein from the global diet, and you're substituting carbohydrate in its stead. And we know when we actually do that to populations in the Omni-Heart study in the US, that increases their risk of hypertension and heart disease. Lipid profiles get worse, et cetera, et cetera. And we don't know for sure that's at higher levels of dietary substitution, but essentially we're now doing that experiment at a global scale on everybody's diet at a smaller level, substituting carbohydrate for protein, and we have to stop and wonder what the impacts on heart disease and other non-communicable diseases will be of that. And then, one other example is a recent one that comes out of Bangladesh, where this combination of sea level rise and more extreme storms, coupled with not very good upstream water resource management, is leading to a lot of intrusion of saline ocean salt water into coastal aquifers. And that intrusion of salt water into the aquifers is making their groundwater more salty in some of these coastal communities. And over the last few years, it's been worked out primarily by a group in London that there's a direct correlation between the salinity of the groundwater and preeclampsia in pregnant women and gestational hypertension, as well as more broadly hypertension in the adult population. And so, again, sort of unwittingly, these sort of large-scale environmental changes are driving very specific effects in particular populations. Mental mental health is a area that I find really, really fascinating. It's one of our least well understood kind of dimensions of planetary health. We know really clearly that natural disasters like Hurricane Katrina or the recent hurricanes Irma and Maria in the Caribbean have huge mental health burdens, and that's been really well studied. That populations that are displaced, people that are losing loved ones, experience really high rates of post-traumatic stress disorder, anxiety, depression, higher rates of suicide, unemployment, and that those effects are durable. I mean, going back and looking at the Katrina population now, we see that those effects are still in existence. What's less clear is, and we know obviously that there are big mental health effects associated with large-scale population displacement. What's less clear is these sort of subtler effects. So Glenn Albrecht, who's a philosopher in Australia, has coined this term solastalgia to describe sort of the sense of loss of cherished places. How many of us carry mental health burdens from seeing places that we love changing before our eyes? How many of us carry mental health burdens from just the knowledge that places are going to be changing in the future, what I would sort of call anticipatory solastalgia? What is the mental health burden for Arctic populations or Pacific Island populations, knowing that their children or grandchildren won't be able to partake in a way of life that goes back thousands of years because their homelands are simply going to be unrecognizable or uninhabitable? What is the cost for us of knowing that our kids may never see a flourishing coral reef, or their kids, or elephants in the wild? So what is the sort of mental health burden of knowing that our own consumption patterns are actually changing in the world, in some instances in really irrevocable ways? Well, those are questions that don't have any answers. And so there's a whole kind of field of psychiatric, eco-epidemiology, or whatever we want to call it, to really kind of understand what the global burdens of disease from these mental health factors might be.
Sam, could I just add that in Minnesota, there's studies that show that within the next few decades, and Beth probably knows this as well, that the boundary waters is going to go from boreal forest to more of an oak savanna. And so that's really an important part of our whole recreation renewal is predictable patterns here in Minnesota, which we're seeing change, and we're seeing all our industries change, our fishing changing, our recreation changing, our farming changing. So we don't have to go quite as far as the Arctic. It's right here, right now, happening to our people.
No, and that's a great point. I mean, since I was 2, I've been going to a spot on Cape Cod in Massachusetts where my grandmother lived on a salt marsh, and we're watching that with just sea level rise really change before our eyes. And it's deeply saddening because that place is sort of in your soul if that's what you grow up with. And I think that it's not something that we tend to talk an awful lot about in the sort of medical or even our kind of Western culture, because we're not sort of put together that way to really identify with place in that intense fashion. But I think many of us do, and I don't think we've done a good job of teasing out what is the cost of that. So I wanted to just sort of quickly try to identify a few overarching themes that I think kind of come out of some of these examples. Obviously, this is not exhaustive. We could have talked about any one of these dimensions of health for an entire hour. But let me run over a few of these overarching themes. The first is this theme of surprise. Some of the health impacts of changing environmental conditions are sort of direct and intuitive. This idea of a triple threat, that if we have more extreme storms coupled with sea level rise, coupled with the degradation of our coastal barrier systems, our mangroves, our coral reefs, our vegetated dunes, our wetlands, that creates a big additional threat to low-lying coastal populations. And we can kind of anticipate that. That's sort of obvious, right? And in the same way that things like extreme heat and land degradation and crop failures are going to combine to make certain places a lot less inhabitable than they used to be. But a lot of the kinds of effects that we're seeing are surprising, right? It would have been really hard for us to anticipate 15 years ago that, one of the effects of adding CO2 to the atmosphere was that our food was going to be less nutritious. It would have been hard to anticipate that these Bangladeshi women would experience higher rates of preeclampsia or gestational hypertension as a result of sea level rise. I think these farmers in Belize would be surprised to know that adding fertilizer to their crops was putting their compatriots hundreds of miles away at increased risk for malaria. And so as we continue to sort of remake and disrupt natural systems into states that they haven't seen in the history of our species. These are not subtle changes that we're talking about. These are the fastest changes across our natural systems in the history of our species. It's not surprising that there will be effects that ripple through all of that complex ecology and make themselves known in ways that we couldn't have anticipated. So another theme is that there are often winners and losers. Usually the activities that we undertake that disrupt natural systems are, undertaken to benefit somebody. So, we're damming rivers to provide water for irrigation and clean energy. We're, clearing land to produce food. We're building power plants to produce, access to energy. We're mining materials so that we can all use our computers and other conveniences of modern life. But it's important to think about, who wins and who loses. So, the people that are getting cheap, clean power and water for irrigation, benefit from this project. But the villagers that are living upstream that are experiencing, exponential increases in their exposure to schistosomiasis from the dams and the snails, they're the losers, And the same thing is true with all of these transformations. The coal-fired power plant benefits the upwind people that are getting cheap energy and electrification, but the downwind people that are getting dirty air don't benefit as much, and future generations that bear the brunt of the climate impact benefit the least. And so it really highlights this issue of sort of where the benefits and the costs accrue, and makes to the idea that our health impact assessments really need to look at that distribution of benefits, both spatially, which populations, and also temporally, now and in the future, who gets the benefits. I think that planetary health also puts us in sort of new ethical terrain. It suggests that every single person on the planet, both now and in the future, is connected to everybody else. That each one of the decisions that we make about what to buy, what to eat, how to travel, whether we have a pet, even whether we have a child, will affect natural systems in some fashion, and ultimately, therefore, affect the health of other people in other places and other generations. And even though the impacts of our individual decisions are sort of infinitesimally small, collectively, they're really quite enormous. And so it connects us to each other in this ethical terrain, that our actions affect the health and well-being of other people in a way that I don't think we've fully kind of wrapped our heads around. It also highlights a closely related issue of equity, which I've already talked a little bit about. So in most instances, it's the poorest people in the world with the fewest sort of institutional, cultural, governmental, or philanthropic resources to help them, who are the most vulnerable to rapidly changing environmental conditions. And so if you think again about our CO2 example, who's going to be responsible for the CO2 emissions that get us from here to 550 parts per million? Well, it's the wealthiest populations in the world. Who's going to bear the burden of those rising CO2 emissions in terms of risk of iron, zinc, and protein deficiency? Well, it's the poorest people in the world with the least diverse diets and the least access to animal source foods in their diet, which are sources of iron, zinc, and protein. And so we actually have just submitted a paper where we quantify that as a sort of environmental justice problem, and we show that there, you can see really statistically significant relationships in that mismatch between who's emitting the carbon and who's experiencing the burden and nutritional effects. And so in that context, I think, we're doubling our efforts to get, humanity onto a different trajectory. The kind of thinking that Teddy brought up at the beginning is not only an urgent health priority, but it's also, I would argue, a moral imperative, and we need to see it that way. One other, I think, important result of planetary health, or sort of overarching idea, is this idea of quantifying externalities. So, essentially, planetary health research quantifies the human health externalities of environmental change in a way that often hasn't been done before. So most of our transformation of natural systems is done for some reason, right? Usually for some sort of economic activity, but if we're assessing the costs and benefits of those economic activities, if we actually bring the health costs of that environmental transformation into the equation, it changes the balance. So if you're determining the social cost of carbon emissions, or the value of a project to dam a river in West Africa, or the impact of palm oil in Indonesia, if you can actually quantify and bring in what are the health costs associated with that project, it may make the project look a lot less appealing. One example we have is that industries that are using fire to clear land in Indonesia started to lose some of their luster when we wrote a paper a couple of years ago, 2016, showing that just in 1 year, in 2015, the haze episodes from that land clearing caused about 100,000 excess deaths. And suddenly, those industries that had been very popular because they're generating tax revenue for the state were shown to also have really huge costs in healthcare terms for the state. So I guess I also have been thinking a lot, the call that I was getting right before we started was from my friend Terry Tempest Williams, who's been at Harvard this year as a writer in residence, and we've been thinking a lot about a sort of spiritual dimension to this conversation. One of the interesting things about these Apollo astronauts that I was talking about is that when they got up into space, they didn't beat their chests and sort of, extol the virtues of the scientific and technological mastery that they had achieved. In fact, they did quite the opposite. This is a quote from James Irwin. He was the 8th man to walk on the moon, and he described his view of Earth. Quote, "That beautiful, warm, living object looked so fragile, so delicate, that if you touched it with a finger, it would crumble and fall apart. Seeing this has to change a man, has to make a man appreciate the creation of God." And you read more and more of those kinds of quotes. These astronauts would look back and feel something akin to awe or reverence. And I think so many of us in places of nature, and I'm not a religious person in the sense of belonging to a church, but I think many of us, in whatever places we connect to, experience something like reverence for the natural world, and yet that awe and reverence seems to have lost its authority in guiding our decisions. When did it become okay for us to treat our oceans and our atmosphere as gigantic garbage dumps? Is there something fundamentally sort of broken in our relationship to nature? And do we actually need to recognize that underneath the sort of ecological crisis that I'm describing, and underneath the public health crisis that it's causing, maybe there is something like a spiritual crisis in which our own sense of our place in the world has somehow gone a little bit awry, and that there's a project to rethink or reinvigorate that the story of sort of who we are in nature and on the planet. And it may be that we need to listen to other voices, that there are faith traditions, there are indigenous traditions that have something to teach us to reinvigorate that story. So, where do we go from here? I think that we do need to acknowledge the scale of the problem. This is not a problem that's going to be solved by tinkering around the edges. We have to acknowledge that our house is on fire, that natural systems are really starting to crumble, and that they're putting us in harm's way. I sort of think about my own training as a medical resident at UCSF, and I remember being at San Francisco General Hospital and seeing patients who, it was the homeless person with pneumonia, it was the intravenous drug user who had cellulitis, it was the alcoholic with pancreatitis, the people that would kind of come in with conditions that they'd had a whole lot of times before and would continue to have a whole lot more times after we treated them, in this sense of sort of futility, that we weren't fundamentally addressing the core problem, and this desire to sort of move upstream and try to figure out how could one help these people in a way that was more durable. And I think that the field of public health is in a similar place. There's no question that vaccinations and vitamin A supplementation and seat belts and smoking cessation programs are all really, 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 really important interventions and need to be continued, absolutely. But maybe in addition to that, we need to think about a bigger set of issues that are even further upstream, that relate to how we sort of maintain and protect our planet's natural systems. I think we need new partnerships, and this is where all of you come in. So new partnerships, new organizational structures, these are not easy issues for us to think about. We're not trained in ecology and natural resource management and climate science, et cetera, and so we need to find our colleagues, we need to break down all of these silos, and we have to find ways to work together collaboratively in order to address these challenges, and that requires new structures that I think you all are doing as much thinking about as anybody in the world, about how to create the partnerships and the structures that will allow us to do that collaborative work. We need new funding sources, as many of you may know. I mean, most of our government funders really work within silos. When I try to get money for my own research, NIH will say, boy, that sounds a lot like environmental science. NSF will say, boy, that sounds a lot like health. And so, there are very few people that are actually funding across those domains. And so we need somehow to flex our academic muscle to say, hey, you guys are behind the times. We need, interdisciplinary centers at some of these government funders that are recognizing these challenges and supporting research in it. We need systems for training, rewarding, and promoting. So, those systems, as you know better than I do, tend to really favor people doing, deep work within their own disciplines that's sort of academically interesting, but not necessarily societally important. And so we need to find ways to value and support and reward emerging scientists that are working across disciplines on these issues. And we need to generate new knowledge. There's still a huge need to really understand how changing environmental conditions are threatening health for which populations, in which places, around which dimensions of health, and how can we manage natural systems to reduce that vulnerability and protect people. So there's a lot of research and knowledge to be generated. One of the really cool and exciting but also daunting things to me about planetary health is it sort of takes everyone and every dimension of human society. When I talk to undergraduates and university groups, it's always exciting that there's not a single person in the audience, no matter who's there, that doesn't have a role to play. And so, across the board, obviously, there's a population issue to think about and access to family planning. There's a huge piece of work to do in rethinking the food system, which is happening right in front of our eyes. And I suspect that as a land-grant college, there's a lot going on here that's really, really exciting in that area. I think it was Norman Borlaug who was in my hotel room. I saw some old guy with a hat, and I thought, I think that's Norman Borlaug. Was he was he here? Yeah, so there you go. You can only see half his face, but it was distinctive. So we need to rethink our food systems and figure out how we're going to produce, a whole lot more food on the planet with a whole lot fewer inputs and reduce food waste at the same time. Same thing with manufacturing. How are we going to embrace circular economies and green chemistry and produce our products with a lot less waste and a lot less toxicity. Urban design is hugely important in this conversation. It's the dominant demographic trend of our times. We're moving into cities. Something like 3/4 of the world's people will live in cities by the end of this century. How do we design those cities so they really minimize the ecological footprint of their inhabitants while maximizing health and well-being? Obviously, we have to decarbonize the energy economy. There are all kinds of interesting things to do for people that are interested in law and policy and subsidies and governance, which are critical. And then there's this whole sort of challenge of imagination, which gets to the sort of spirituality, the humanities, the storytellers. How do we kind of rethink our place in the world? And ultimately, I think we need sort of a new narrative that rejects the one that streams into our devices, every minute of every day that tells us to be happy. We just need to consume a whole lot more stuff and embrace what we actually know to be true from our social sciences colleagues, that what actually makes us really happy is spending time with people we love, working towards things that we're really committed to, being part of something bigger than ourselves, and taking care of each other. And that's what makes us happy, but it requires sort of rejecting this very heavily consumerist narrative that we're getting. So I guess in closing, it's hard to know exactly what was going through Bill Anders' mind when he said that we need to go to the moon in order to discover the Earth. Perhaps one of the reasons that so many of us are, I think, mesmerized by those self-portraits from space is not only the swirling beauty of those patterns of blue and white, but also, I think, a new awareness that they evoke in all of us. From space, our planet is beautiful and unique, yes, but it's also small and somewhat shockingly contained. These are not images consistent with limitless resources or unlimited capacity to absorb our waste. They evoke awe, but also an instinct to protect and nurture. Another American astronaut and the sixth scientist to walk on the surface of the moon, Edgar Mitchell, described the Earth's rise from the moon's surface. Quote, "Suddenly, from behind the rim of the moon, in long, slow-motion moments of immense majesty, there emerges a sparkling blue and white jewel, a light, delicate, sky-blue sphere laced with slowly swirling veils of white, rising gradually like a small pearl in a thick sea of black mystery. It takes more than a moment to fully realize this is Earth, home," unquote. So when Anders wrote that he, quote, "discovered the Earth," perhaps he meant that we discovered a new relationship to our planet, that our home is both awe-inspiring and fragile, and that just as it nurtures us and all other living things, it also requires our care. So let me close with that and hear your questions. Thank you.
As Sam said, there's not a person in this room that can't be part of the solution. And so to my dear colleagues in the School of Nursing, I think we have the talent and the skills to really be part of creating a healthier planet for us. And I look at the staff in this room and think of I get teary. I look at the staff in this room who are so important to us, and you are about bringing the new people in and firing them with hope and helping them understand that there is a path to the solution and that they're becoming part of that path. So this is really our time to engage. Dr. Myers, just be in conversation about, okay, what can we do? You have tons of assets. How can we put these to work? So why don't we?
I have a question.
Yeah.
I'm just curious.
Would you say who you are and then what your background is? Because
I'm Mary Van Bennick. I'm the coordinator for the Family Nurse Practitioner Program here. And I have a question for you. We're living in a very trying time, and honestly, some of our politicians could be hit over the head with this stuff, but they're not moving. What is your advice or suggestion? How do we address that in moving forward?
Yeah, I mean, I think a few things about that. I think that our federal government has very rarely led on societal change. If you go back and you look all the way from abolition to suffrage to civil rights, those things were not led by the federal government. They were led by people who felt a sense of outrage and made their voices heard. There's a sort of famous and I think apocryphal story about FDR when there was a labor movement, and there were a group of industry leaders that came to him, and I can't remember what the issue was that they were advocating for. But they came all upset and they said, this is just crazy. We have to do X, Y, or Z. And FDR said, I couldn't agree with you more. Now go out and make me do it. And but that idea that politicians are not necessarily going to lead. Yes, we have a particularly horrible administration with respect to these issues right now. But we had a fantastic administration with respect to these issues in the previous administration. We didn't make a whole lot of headway, and one of the reasons we didn't is because we weren't making them do it. And so I think that what matters a lot more than waiting for our officials to really lead us into sort of a new place are the kind of collective action, movement building efforts that are underway around the country. The Sunrise movement, that there are many Mothers Out Front that's organizing women in climate change. There are lots and lots of them around these issues. The other thing I would say is that the federal government is not the only level of government, and that when you look at municipal government, the picture is completely inverted and really inspiring. And so I propose that we avert our eyes for another year or two to the federal level and look at what's happening in the cities, because the cities are coming together. I mean, there are a whole bunch of these international groups that are, maintaining the Paris Accord. There are, hundreds and hundreds of cities in the U.S. and thousands of cities worldwide that are coming together around this agenda. And for a lot of interesting reasons, cities are much more capable of tackling this kind of this set of issues in a way that doesn't get so politicized. They tend to be more pragmatic, and they just kind of come together and figure out solutions better. So I think there's a lot of good government that's happening below the federal level. Yeah, I think you were next.
Well, Sam, thank you very much for your inspiring comments. I'm Mary Jo Kreitzer. I'm a professor in the School of Nursing, and then I also direct the Early Bakken Center for Spirituality and Healing in the Interdisciplinary Center here at the university. And what's on my mind as you talk about how you answer that question and kind of put it back to us is thinking about how do we leverage networks. And I'm thinking of the global nursing network. And nurses are the most trusted health profession in the world, and it's the largest health profession in the world. And so it makes me really curious about, we can think of what can the School of Nursing do and a center, what can we do in the state, what we can do in the country, but I'm really wondering, and maybe Teddy, what is the ANA doing about this issue? How can we get leverage on the ANA and the International Council of Nurses, the ICN?
And the AAN.
And exactly, because Yeah, the Academy of Nursing, because if we did that and if it became partly the role of nurses to educate the public.
So we are doing some of those things. I won't take too much time to explain it, but American Academy of Nursing, we're working on a climate change initiative right now to set it up as a key leading umbrella there. And I'd like Shanda to speak about the Nurses Climate Challenge, because this is a really exciting model. So briefly, can you?
Absolutely. So the Nurses Climate Challenge is co-led with Alliance of Nurses for Healthy Environments. That's the only national nursing org focused on the environment, grander than climate change, and healthcare without harm. And the model is nursing-led education on climate change for health professionals, regardless of setting. And so we've had some faculty members take leadership with that here, and a lot of students. And I think the AAN is trying to incorporate that Nurses Climate Challenge into that position statement.
The other thing is that you've been involved in is that the Planetary Health Alliance just a month ago launched its Clinicians for Planetary Health initiative. And it's almost precisely what you just described. It's sort of predicated on the fact that nurses and other healthcare workers are hugely trusted messengers. And the goal is to reach out to all healthcare practitioners and traditional healers around the world to come together to generate sort of patient-facing materials, really built around the proposition that there are a handful of really simple core messages that make a huge difference in terms of individual health, but also make a huge difference in terms of planetary health. So, active transport, walking and biking to work, vegetable source diets, unless you're in a very poor part of the world where you need more animal source foods, but by and large in the wealthy world, more vegetable source diets, thinking about your sources of energy in a community. So there are certain things that are just really good for you that are also really good for the planet. And so the idea of making sort of one-page materials that can be handed out in a clinical setting that are sort of language and culturally appropriate. And we've got now a website for that, and we're trying to bring together groups that want to be sort of part of it. And I mean, we would absolutely love to work with any of you on sort of helping us, take that on, take it over, push it forward. We're not feeling at all proprietary about it, but precisely in response to this, how do we get clinicians in a role? We're also starting to think about how do we get faith leaders in that role, so that in temples and churches and synagogues and you name it, faith leaders are sending a message about stewardship or creation care or however it's framed in different traditions, but they're also trusted messengers. And so how do we send this work out? But I'd love to work more with you guys about this on the sort of the nurses piece of it and how to have that represented in this clinicians. Yeah.
I wanted to introduce myself. I'm Beth Mercer-Taylor from the Institute on the Environment, and I work with students who are part of the Sustainability Studies minor, which is actually a 5-college program, but I also support sustainability education for any university students. So if you are working with students in nursing or in other parts of the academic health centers, I've heard and met a lot of public health students. They voice their role in this frequently, but I know we could do more. And at the Institute of the Environment, she's not here today and really wishes she could be, but my new director for our leadership and education programs is Kathy Jordan, who has an appointment in pediatrics and just was promoted to full professor. But she's at a national conference that should be sort of part of this loop because she works on children and nature connectedness. And there's a really great research she's brought us up to speed on at the Institute about the likelihood of pro-environmental behaviors later in life if you have a nature play experience early. And that's really a global issue. So if you look at the intersection with urbanism and what was just presented here, you see that, I think, along with the other items that might go on that one pager for your clinical setting, think about the nature play piece. And then Kathy will be back. She's in Oakland at that conference right now. She would be a great person.
That's a great point. And green space is another thing that definitely should go on that. And then some of the background, understanding of why access to green space is so therapeutic, for sure. Yeah.
I'm Dan Pesh, and I'm a professor in the school and direct the Densford Leadership Center. I appreciate your talk. Couple of things that popped out at me, though, is that a lot of this has to do with an interest area of mine in terms of foresight and futures thinking. My challenge is, my question is, how do you activate people to have a futures thinking mindset as opposed to being stuck in the here and now? That would be one question. And the other question is, this is an incredibly complex challenge that requires a lot of systems thinking, and I want to know how you educate people in terms of the systems thinking in a curriculum that would enable them to deal with the complexities and the combination of relationships that you've sort of described.
Yeah, great questions. I mean, my glib answer on the futures thinking is talk to moms. I think that this idea, my wife's been very involved in this group, Mothers Out Front, and it's really built on this idea that women are sort of, especially moms, are hardwired to be thinking about future generations, and that it's sort of a natural thing not to discount the future at the same level that many of the rest of us do. But I agree with you. It is a big challenge, and there's a lot of research that describes exactly that. I think that, we're seeing this right now in the present, and I think that needs to be emphasized, that we're not just talking about, this is bad stuff that might come down the pike, but this is bad stuff that's happening every day right now. And so that's an important part of the message. It still bumps into the challenge of a lot of the bad stuff is happening in other parts of the world to other people, which people discount. And it's incremental change. So that's not the way, human beings are hardwired to address the sort of frog in the pot problem. So there are some sort of behavioral science questions and challenges that need work. What was your second question?
Systems thinking.
Yeah, so no question, we had this conversation. I mean, I don't frankly get why, medical students are learning physics. Or frankly, even some, sort of biochemistry and histology. I mean, stuff that I remember learning in medical school that was just, I wasn't going to become a pathologist. And so, I would have gotten so much more out of an ecology course than out of physics or histology or, some of the other basic science. And one of the great things about ecology is it is fundamentally a systems science. And so I do think we need to consider how we're going to train in the sciences, really bring forward sort of ecological thinking, because these are ecological problems. And, then we need to think about when we're trying to train undergraduates and graduate students, how do we teach them, something like that Belize example. And so we're actually working right now on a whole anthology of case studies in planetary health that is being written right now. We're working on a textbook in planetary health, but really with this emphasis on just sort of examples of these sort of systems problems.
Are you familiar with the Social Environmental Synthesis Center? It's at the University of Maryland, but there's a suite of case studies across disciplines that apply, systems thinking for your particular area of study.
This is Zinc, you mean?
Yep, Zinc. The case study library is really a helpful one. There's another one actually, University of Michigan, called Galaxy. And we also do teach systems thinking for undergraduates in the sustainability studies minors.
Great.
That's a great point. It's an important part of the curriculum. Yeah.
My name is Debbie Ringdahl, and I'm also faculty in the School of Nursing. I'm the midwifery faculty, and I co-direct the Integrated Health and Healing Program. And my son lived in Japan for 2 years, and so I had the afterglow of being in a different country and visiting and seeing the way that they address problems as being what appears to be vastly different from our country. And what strikes me about culture, to whatever degree I understand it after living here, X number of years, is that we don't do a very good job of community. That we have been, hardwired to be more individualistic and look at things from that vantage point. And it was so noticeable in that country and culture, you know, with the little snippet of time I was there, when they wear their masks, it isn't to prevent illnesses so other people don't get sick. You know, it's like a completely different shift in terms of looking. And so as we teach, as we work in organizations, you know, as we live our lives, I guess that's my question to you. How do we build a different mindset around community so that we look at this through that lens? Because I think that that's a cultural problem.
I couldn't agree with you more, and it's a great point. It's sort of what I mean about the challenge of imagination, that maybe the biggest challenge we have is sort of what story are we telling ourselves about sort of our place in the world, and part of that story needs to be a community story. And I agree, I'm really struck by this sort of strain of, you know, you could call it individualism, and certainly the American story has this sort of self-reliance individualism story in it, but I think that's almost too kind. I mean, there's a kind of I want to get mine element. It's a selfish individualism, and you know, you see it in the way we zone compared to the way people zone in Europe. You know, this cluster zoning, and then these shared fields, and everybody can walk on each other's lands. And here, everybody's got their fence in their yard. You see it in, you know, one of my bugaboos. I'm sure this is crossing lots of people in Minneapolis, but is snowmobile use, which is, you know. It just drives me insane when I want to go cross-country skiing in a beautiful, pristine valley, and you know, the experience of 50 people that's beautiful and peaceful is destroyed by, you know, one Yahoo who wants to go tearing around on a 70-mile-an-hour snowmobile. And we were just in Europe cross-country skiing, and it was just amazing, like a completely different attitude. I mean, snowmobiles are just banned unless somebody's in the midst of a terrible emergency, but it is a really different culture. It's the kind of keep the government off my back, I'm going to get mine, and you know, the hell with everything else. And I don't know how you create that sort of culture change. It's what I mean about we need the humanities and the faith traditions, and a lot of thinking that's certainly not my area of expertise about how you start to tell yourself a different story about who you are and what the role of government is in your lives, and you know, it's a different thing. I'm not sure how we get there.
Hi, I work student services at school, and I was wondering if I noticed some of your slides were from like 1996 through some of your research through like now, and how has kind of the public opinion, consumer refusal to consume anything that's genetically modified impacted kind of your world either positively or negatively? Because I mean, I love GMOs, but I know that's not popular opinion. And I would think, not having researched it, but if something is not genetically modified, but it's also not organic, then that means they maybe use more fertilizers and more insecticides, which to me would be worse than just having a genetically modified product.
Sure. Right. So, I mean, the short answer is I think that there's a sort of irrational conversation about GMOs in this country, and I don't see any reason to be banning, GMOs. I think that there's also a slight sort of potentially slightly elitist strain to the conversation, that there's sort of a food conversation in the United States that's about local and organic and banning GMOs, and I think there are elements of that that are really praiseworthy, but there's a global conversation about 1 billion people who don't have enough food to eat and the need to increase food production at the fastest rates in history in order to keep up with demand, and to take this sort of GMO arrow out of your quiver when you're faced with the level of challenges that we have in terms of just feeding the world's population strikes me as very, very irresponsible. And I wouldn't want to be the person who explained to the mom in Mali that her kid's going to go hungry because I have an ideological problem against GMOs. So I think we need all the arrows in the quiver. I think that, figuring out how to regulate, new technologies is really important, and we're going to be transforming our food system in all kinds of ways. I think it's going to take sort of a marriage of a kind of technological set of innovations like precision agriculture and robotics and artificial intelligence with, cell-based meats and dairy and cricket flour and, insect-based foods, alongside a set of sort of traditional knowledge from agroecology, agroforestry, organic agriculture that's about healthier soils and protecting from land degradation. So I think we need to start getting away from this sort of debate and just start finding a third path that involves integrating knowledge from a lot of different sectors so that we can address this set of problems in a practical way. So I agree with you that being anti-GMO just in a kind of absolute way doesn't make sense. Great.
Thank you very much. Go forth, have lunch, talk with one another, strategize, connect.
And everybody, please, one last thing, please consider coming to the Planetary Health Alliance website, and we'd love to have you sign up for a newsletter. It is a community, we have an annual meeting, we have this clinicians initiative, so we'd love to have you join us.
Together to make a gallery. I did a lot of